Hi everyone. Today I'm going to deal with the nutritional intervention on diabetes management. So, the introduction, the nutritional therapy and counseling are an integral part of the treatment and self management of diabetes. The main goals of nutrition therapy are to maintain or improve the quality of life and nutritional and physiological health, and thereby preventing and treating the acute and long term complications of diabetes and its associated conditions. In diabetes mellitus, nutritional intervention plays a very important role. Emphasis should be placed on a well-balanced diet with whole grains, vegetables, lean proteins, and healthy fat. Monitor the carbohydrate intake. Also, opting for a complex carbs and controlling the portion size is also very important for the dietary intervention and also controlling the complications of diabetes. The peer-reviewed article that I'm going to deal with is the comparative effectiveness of a mindful eating intervention to diabetes self-management intervention among adults with type 2 diabetes. It is a pilot study by Miller. So mindful eating approaches possibilities are very effective and important approach for the control or the management of weight and also controlling the glycemic index in people with diabetes. Diabetes self-management education plays a fundamental component or fundamental role for the effective self-care. Also, a little research has been linked with the effect of mindful eating with the diabetes self-management education-based treatment. This study has been linked to the effect of those two interventions in adults with type 2 diabetes mellitus. Also, eventual randomized controlled trial with the two parallel interferences were used. So the participants that are included in the study were those aged between 35 to 65 years with type 2 diabetes mellitus for 1 year or more, body mass index of 27 or more, and hemoglobin HbA1c of 7% or more, who were assigned casually a 3-month mindful eating or smart choices TS diabetes self-management education-based intervention. So follow-up usually happen 3 months after the involvement completion, and the dietary intake, physical activity, weight, HbA1c, fasting plasma glucose, and fasting insulin were evaluated using repetitive measures analysis of difference with contrast analysis. There was no significant differences between the groups in the change in weight or glycemia at the study end. Education in mindful eating and diabetes self-management facilitates improvement in dietary intake, modest weight loss, and glycemic control. The obtainability of effective treatments keep patients with diabetes choices in sustaining their self-care needs. So the one of the important formula that I evaluated from the study is that the exercise plus diet is equal to health. That is, exercise or diet can help manage any complications or any diseases. For example, if you're considering the diabetes, exercise along with the diet can help result in a good health.
Approximately over 3 million Canadians are suffering from diabetes, and it increases at an average rate in every year. And it is very important to treat the diabetes in adult to maintain the overall health and preventing the complications. So, proper management of diabetes can help them to control blood sugar levels, reducing the risk of heart diseases, kidney damage, vision problems, and nerve damage. It also promotes the better quality of life by minimizing symptoms and improving energy levels. Regular monitoring and medication adherence and lifestyle adjustments like erosion effective diabetes management. So this is a picture which shows the diabetes by age group and the gender. As it is evident from the picture that 75 years and older male are more suffering or susceptible to diabetes. I am going to discuss about the trends in diabetes management. It is important to keep a track of national trends in diabetes management in order to identify areas of progress and gaps in diabetes management. In this study, the researchers evaluated trends in diabetes care by analyzing three nationally represented serial cross-sectional surveys ended between 1999 and 2016. The main participants were included non-pregnant US adult aged 18 years or older who had been diagnosed with diabetes. The researchers measured different factors including American Diabetes Association's general recommendation for glycemic and cardiovascular risk factor for control, medication usage, physical activity, and dietary intake. The result showed that the proportion of US adults with diabetes who achieved glycemic control followed a trend from 49.6% in 1999 and 2004 to 58.6% in 2005 and 2010, and then decreased to 55.8%. And moreover, the aerobic inactivity declined while adherence to aerobic activity and resistance training recommendation. Engagement in such practices increased for most output. However, adherence to saturated fat and sodium recommendations down. Here are some of the trends in diabetes management as given below. According to the Public Health Agency of Canada, diabetes remains a complex condition to manage despite advances in treatment and care. Optimal control of blood sugar level is essential to reduce the short as well as the long-term complications. The American Diabetes Association has released its 2023 Standard of Care in Diabetes, which consists of new recommendations related to sleep health and physical activity in people who are diagnosed with diabetes. So, management of diabetes in older adult is a daunting task due to unique health and psychosocial challenges. Medical management is obligated by polypharmacy, cognitive impairment, urinary incontinence, injurious falls, and persistent pain. Healthcare providers now have several traditional and contemporary pharmacologic agents to manage diabetes.